Good afternoon. Thank you for joining us here at the EMA office in St. Clair County. Our daily briefing. Sam Bierman is with us from the Health Department with some numbers. Sam, welcome.
Thank
every
you.
day. Appreciate it.
Thank you for having us back again today. As we have said the past couple days, the numbers don't lie, and we will see that again today. St. Clair County totals are as follows. We have 294 that have been tested. We have 41 positive, which is an increase of 12 from yesterday. We have a female in her 60s, male in his 50s, a male in his 90s, another male in his 60s, a female in her 50s, another male in his 60s, a female teen, 3 females in their 40s, a female in her 70s, and a female in her 20s. So as you can see, that was a significant bump since yesterday. We have 201 negative tests, 52 pending, and we are still currently at 2 deaths. State totals are 30,446. We have 5,056 that are positive, which is an increase of 461 from yesterday, and 72 deaths, which is an increase of 7 from yesterday. So you can't deny the numbers. I mean, they are rising, and they're going to continue to rise for a little while longer.
Well, we know that, and we appreciate you coming over with that information, and we're going to be here to do it. Chairman Kern?
So it's quite a range of ages.
Yes.
This impacts everyone.
It does.
And the recommendations stay the same. Sam, stay home.
Stay home. Even when you're home, socially distance yourself from those in your household. Continue good hand hygiene, even though you're at home. Those things will not end. Even when this time is over, we're gonna tell people to continue to do those things.
And our numbers jumped significantly, but it appears the state numbers actually were on the decline a little bit. Hopefully that's a trend.
We can always hope. They have said that they don't think that we have hit our peak yet, that we will still climb a little more. But only time will tell. And by staying at home, by socially isolating and distancing yourself, and staying away from others, that is your best chance to stay healthy.
Thank you, Sam.
Absolutely.
Very much. So we've seen that big increase. Let's keep doing what we're doing. We're making a difference. The one problem that you have with staying home and these recommendations, you'll never know whether what we did made a difference. We know it does, but you're never going to know specifically if there was a person that you didn't infect, or if a person wasn't able to infect you, that you could pass it along. So by doing all these things, we know that we're going to make a difference, and we will get to the point where we will peak here in St. Clair County, and we will start on the decline again. There's one study out there that says that it probably won't be until the middle of April. Specifically April 16th is what they're saying. They're also saying that we won't get to this same point with the number of new cases until maybe sometime in May, that this is going to rise and then it's going to go down again. And so we're in this for a good while longer. And so we'll just need to hunker down and continue to do what we're doing. The courthouse is, as we said, is closed to the public, but I would like to talk about the building and zoning and mapping and platting departments. They're run by Ann Markozich. She's the director, and today she issued some guidance, just letting people know what services are being offered right now. Employees have their laptops. They're working remotely, if not from the office. They have all their desk phones transferred to their cell phones, so we can continue operating the kind of things that you normally get out of that office. We're issuing building permits via email. We're receiving the property maintenance complaints, and we're logging them to address once we have the courthouse reopening and we have the personnel to be able to go out and look at those specific sites. New construction inspections. The contractors call for the inspection to be logged and then take pictures, and they can continue construction based on that. We're only doing emergency electrical inspections at this time. As far as occupancy inspections, and we would like to make the point, what we're addressing here in St. Clair County is for the unincorporated areas of St. Clair County. We're getting a lot of calls about City of Belleville occupancy inspections. We don't do those. We only do inspections in the unincorporated area. So what I'm talking about only applies to the unincorporated areas of St. Clair County. But as far as our areas go, occupancy inspections will be logging a time for you to get inspected, but we will issue the occupancy permit right now via email or phone, just based upon your call and logging a future inspection in. If you need an inspection to close on a residence with the bank, we will come out and we will do that inspection. As always, the switchboard is open from 6 a.m. to 6 p.m. at the St. Clair County Courthouse, 618-277-6600 if you have any questions in any department. We're fortunate today to be joined by Mike McManus. He's the executive director, the head of Memorial Hospital BJC here in Belleville, and Mike is here to kind of give an update and tell us what's going on. Mike?
Appreciate it, Mark. Thank you for having me on.
A Belleville felon, I guess I
Yes,
should say.
both Memorial and Memorial East. Give you a little update from the hospital side. We had a good weekend. It was kind of steady state over the weekend. We did see an increase last Wednesday or Thursday in our hospital census, which caused us a little bit of an alarm. And to give you an idea, in the hospital right now, we have 4 confirmed cases that we're treating in our hospitals, and we have about 20 patients that are called PUIs, patients under investigation that are in our hospital, and while we're waiting test results. That jumped up, like I said, last Wednesday, Thursday, but over the weekend, it was kind of steady state, which we were grateful for. They're sick people, though. It's concerning, the people that have been admitted. We have about 7 of them are on ventilators, and so it's serious, and it's something that is we're doing our best to handle and manage. Each day within the hospitals, we test about 30 people daily at our locations, and the numbers of testing has pretty well been steady over the last week or so. Said about 30 a day. The resources, I think, were good. We asked for some donations, which I've been grateful for, and we're doing okay in managing our PPE and our supplies. It's very stressful, though, for the staff, especially those staff that are in those units that are managing these folks, because it's constant vigilance in terms of how you're dressed, how you're taking care of people, and things like that. Total, we've probably tested over 250 people. I know I heard the county number at 294. We probably tested over 250 people. Now, that's not specific to St. Clair County. They could have come from anywhere. And so continue to be active. This is probably 2.5 weeks into this. Our command center's up and running. It goes every day. We have, over the weekend, I was probably on 5 calls each day, whether it's BJC calls or Memorial Hospital calls on Saturday and Sunday. So we hear the same things you hear, that this is likely go through mid-April. And today was a good day in terms of reporting of Illinois numbers statewide. I think you said 461. Yesterday was over 1,100. And that's always that was scary to hear that number. So I was glad to hear the numbers today.
So, Mike, you look tired.
Yeah, it's been a long 2.5 weeks, but not as tired as some of our folks taking care of the patients. They are. Oh, by the way, one of the things I forgot to mention. We are testing all of our staff now coming into the hospitals. We started over the weekend, and so we have 3 entrances set up at the Belleville Hospital, 2 at East, and so we take temperature and we do an assessment of every employee that comes in, and physicians and things like that too, because actually the highest incidence rate of COVID is actually among healthcare workers, which shouldn't be surprising.
So, your healthcare workers are working overtime, they're working extra shifts. They've always been superheroes, doctors, nurses, healthcare workers, EMTs, but they're rising to a new level, and they're meeting the challenge. Is the equipment there, if this will level off, if it levels off close to levels where we are, the equipment is there and available in our local hospitals to be able to handle this emergency?
I believe so. We had to develop BJC wide, every hospital, and we're not unique. There's other hospitals here too. We had to develop a surge plan of if there was a large number of patients that were admitted to hospitals, how we would handle them beyond our normal capacity, both our hospitals. We developed that plan, we submitted it to BJC. They're sort of knitting that together among all their hospitals across the system, St. Illinois and Missouri hospitals, and then coming back to say, okay, this is what we think the projection is going to be. Here's what we have in terms of surge. Are there deficits and gaps? BJC-wide, we're creating a manpower pool. We've already emergency credentialed several physicians from Missouri that can work in our hospital, and so we think we're okay. But it's not so much the equipment or the beds. It's just the critical care staff, and that's where we have had to bring in some additional support. Beyond just our normal ICU nurses and things like that, and that'll be an area where we may have to rely, worst case scenario if things grow, rely on the system-wide manpower pool.
What's the number one thing that people can do to help you?
Yeah. Thank you. The number one thing is to stay inside. Adhere to this shelter in place. I'm not sure what's going to happen. Work with Illinois. Federal government talked about extending it to the end of April. Illinois is supposed to end on April 7th. Would not be surprised personally. I know nothing if that were to be extended. And that could be the number one thing, because the longer this goes, from a hospital perspective, the more it stresses the resources of the hospital, the people, the supplies, and things like that. So that's the number one thing. And I know we keep saying that over and over again, but it really is true. And hopefully, we'll get through the other end of this. But I think we've planned. Both Memorial and I know St. Elizabeth's has too. I think we've planned. I think BJC's planned as much as we can, and we just are kind of watching and waiting. But we are seeing the numbers creep up. One of our other hospitals in Missouri had a spike too, like we did, but they're sort of continued on where ours sort of leveled off. So it is a little concerning.
So that's Mike McManus, the president of Memorial. Mike, we were really happy you came here today, and we appreciate. I know that you are worn out, and so you coming here means a lot to us, and we sure appreciate your effort.
No, I appreciate the counties too, and everything you've done to help us, and all the community support that we're receiving. It's been very nice to see, and it's encouraging for our staff to see that they have the community back.
Well, you tell us we're with them. Thank you.
Chairman, I got a couple of questions for Mike. We get questions all the time about the policies at the hospitals on visitors.
Yes.
Can you tell our viewers what that policy, if you know what it is?
Sure. Right now it's a strict no visitor policy, except in certain circumstances. Obstetrics, there's one visitor to go along, and then in certain circumstances, if somebody's on hospice or someone's in a situation like that, end of life, I believe we make some exceptions there too. But no visitors right now.
Good. And then, we see a lot of talk on the national news about ventilators and PPE equipment. In a worst case scenario, you feel we're suitable here for ventilators and personal protective equipment?
Well, we're still in conservation measures on PPE, personal protective equipment. We do believe that we have some shipments coming in from the system later on this week and next week, and so we feel that we're in a good spot right now, but we're still conserving. And the main reason we're conserving is again the uncertainty of the duration. And how long this is going to go. The worst thing you could do is sort of be penny wise, pound foolish right now in terms of your conservation. We're not putting anybody at risk, but we are being conservative. So we feel like while it's not perfect, we feel we're in an okay spot right now from a PPE perspective. But the shipments haven't arrived. And you can't until they're in the warehouse. You don't want to count on it. And in terms of the ventilators, we have some emergency ventilators back up with. We have about 34 ventilators with our two hospitals, and we're prepared with our surge plan. We also have some backup ventilators that we can put into use and do that. I think the ventilator issue, time will tell. Right now, I think we're okay, but if the surge plan is kind of worst case scenario, that could be a challenge also. Now, the good news, I would say on this, and it's not good news, none of it's good news, but what I can say is other areas of the country that are further along in the curve, as that starts to wind down, then we're in a little better position in terms of resources, I think, as places like China begin to mobilize again.
Very good. Okay, well, as the chairman said, we appreciate you coming in here, and we appreciate you and St. Elizabeth's providing people such as yourself coming in each day to give our viewers an update. So again, thank you very much.
My pleasure.
As we move on, just a few things on the EMA side. The conference call we do every morning with the hospitals and EMS agencies continue. We do that every morning at 8 o'clock to get the most recent update from that. Today, Chairman Kern and myself and the staff had conference calls with all the local mayors, police chiefs and fire chiefs, keeping them updated on some procedures that we're changing. It's always good to know that we've got our first responders and our city leaders out there supporting their communities, and I want to thank each and every one of them. You're going to be seeing over the next probably 48 hours some of the lighted road signs Chairman Kern and us worked on today. The O'Fallon and Fairview Heights has got some that they're going to be putting in place, basically keeping that message out there in front of you is social distancing and stay at home. So you'll see them strategically put throughout the county is what we're working on over the next 48 hours. Today the governor sent out, and you'll see this on the EMA page and the county page, we'll get it put up, about policies that grocery stores are going to have to start putting up there. There's several guidelines that they put out, such as announcing social distancing expectations throughout the PA systems periodically throughout the day, set up floor markers in the stores to show people how far to stay apart. So this will all be out there. So again, I think a lot of people that's been posting, complaining about that stuff. So this hopefully will help take care of that. Again, Chairman, we're in this. We're going to keep going. We're not going anywhere. So
No, and you're going to post the grocery store guidelines?
Yes, they'll be posted up there to where the citizens will know what the governor is asking that all the store chains do, and that's from the mom and pop stores to the big grocery chains. So,
And you're the eyes and ears. So if you see that this isn't being followed, take a set of those with you, or tell them where the website is and how to access them.
print them off. Tomorrow on the briefing, we've got another healthcare representative along with the health department to be here, and then also you've arranged for a school teacher to come in. And again, as the duration of this goes on, children being at home, hopefully the teachers and them can come in and give kind of some suggestions on how to deal with them. So that'll be tomorrow afternoon. We're going to be back in just a few minutes with our ladies to translate this to our Spanish communities. Thank you once again, and we'll see you approximately around 3:30 tomorrow.